Today I want to demonstrate the use of a material called Spray and Stretch. It's actually the brand name. It's made by Gebauer Company, and it's a vapor coolant spray that can be used in a dental setting primarily for diagnosis to determine how much muscle involvement is the source of pain. So we're able to diagnose the etiology by treating muscles independently to determine how much relief can be accomplished through the use of cold spray therapy. What I believe happens is there is a reflex inhibition that occurs when the skin feels cold. The proprioceptive and nociceptive impulses are blocked to the point that pain is relieved. It doesn't always work 100%, and that's why we're doing it, so that we can determine how effective is it. Is the pain coming from the muscles, or is there another source? So if I were to get no good response, I would start wondering if there's another source besides muscle strain or local muscle pain. So I'm going to demonstrate this by just, first of all, what I will do is I'll show it to the patient. I'll explain briefly what it is that I'm going to do, and then I demonstrate on my hand by just spraying it onto my hand. Are you able to see that? Okay. Then I'll also spray it on the patient's hand so that they get a feel for what it's going to do, because it is quite cold, and so there's an initial wake-up shock from the coldness. In dealing with muscle tension type headaches, I usually, or even jaw and muscle pain, I usually always start on the trapezius and posterior cervical area, and I will do both sides. Even though one side is the painful, I still want to do both sides to have balanced function on the muscles. I'll also often ask the patient, at what level is your pain, with 0 being no pain and 10 being severe pain. The other day when we worked with him, it was at a 4. So I'll demonstrate now. What you need to do is expose the trapezius area, and your assistant or your patient, but usually, for instance, in Emma's case, her hair stays away from the area I'm spraying, and I will go along the muscle, starting at the superior area. I will go down and stop right at the trapezius. Usually I'll do 3 or 4 sprays, and then with the patient laying their head back, I just reach in and I start to knead on this trapezius muscle using my thumb and fingers. I prefer to do this without gloves, because gloves tend to stick and catch the hair, and I don't want to introduce any new symptoms from the process. So I'm just doing a gentle massage. In doing this, I'm milking out lactic acid buildup from muscle tension. As that happens, new blood is able to flow into the muscle, and this is newly oxygenated blood, which helps to also give the muscle relief. We'll lean forward again, and we'll treat this side. You should always do this with an assistant present, so that there are at least 3 of you in the operatory during these procedures. Lay your head back again and just relax. So we're just giving a nice massage. It's like kneading the muscle and then extending up into the posterior cervical and suboccipital area, just to get things calmed down. Once you've done that, you can also assess the tension in the muscle. If you feel it's very tight, you can repeat this step a little bit more to just get more relaxation. Then to go to the facial muscles, you want to cover the eyes, and your spray will start at the temporalis and go down to the masseter and to the border of the mandible, stop, and then come back up and spray down again, and each time do the same procedure so that you're going aligned with the muscle fibers. And then I like to use the back of my fingers to just gently massage, and again I'm trying to massage in the direction of the muscle fibers to just try and get blood flow and relaxation to the muscles. Patients will often say after this that they feel like taking a nap because things are so relaxed and comfortable compared to where they were when they were in pain. Again, treating both sides so that we keep the system balanced equally and trying to avoid any instability in the muscles. Now I'll have you cover your eyelids with your fingertips. We're going to now do the frontal area and just run the spray across the frontal area to get that cooled as well. Now you can let your fingers down, and I just gently massage this. I like to do this with the patient sitting up so that it improves access to these areas. And then I will, at this point, or even at different stages in the process, I will ask the patient, at what level is your pain? When we did this in class, Emma started at a level 4. And we started on this side with the posterior cervical, suboccipital, and trapezius muscle, and I asked her what level her pain was, and miraculously she said it was gone. It doesn't always happen, but it's really pleasant when it does, because it tells me that the pain that she was experiencing is most likely local muscle soreness or muscle strain from perhaps being a dental student and treating patients all day. So I hope that helps to better understand the use of this product and how it can be used for diagnosis for the patient, especially detecting muscle involvement in tension type headaches and jaw and neck pain.